programs. I'm now going to introduce Anita, Somai, and Beryl Piccoloantonio, who are from our General Assembly. Thank you very much.
I think ChatGPT and our previous speaker just gave my talk for me. So I just want to first of all, thank the audience for coming here and listening to all of us speak, as well as all of the speakers before us who have really emphasized the dangers of what's happening in America. Exactly. So, for those of you who don't know, my name is Anita Somai. I'm a practicing OBGYN and also a state representative. We are here not just to protect our transgender kids, but to protect our families, our parents, our aunts and uncles, everybody that depends on the government resources that you've heard about today. Medicaid is not just another government program. It's a lifeline. It's a safety net. Without it, people will die. But today, Medicaid is under threat, not only at the national level, but also here in Ohio. Why is that? Because our state budget is dependent on what the federal budget gives us. So these are not just numbers on a piece of paper. These are real lives. These are real people that will be impacted. You heard about Medicaid expansion. Medicaid expansion, if it is cut, there is a trigger bill in our budget that would cut Medicaid expansion. Not just cut it, but it says it must be cut. We're looking to change that language in the budget to say it may be cut. And that's something you all can do. You can call the Statehouse, call the Speaker of the House. If you have friends in rural areas, tell them, do not let that trigger happen. Do not let Medicaid expansion get cut in Ohio. It'll affect close to 800,000 people who will lose their insurance because of those cuts. That doesn't even count all of the women, the children that will be affected. 1 out of 3 kids in Ohio uses Medicaid for their insurance. Over half of our prenatal care deliveries in Ohio are funded by Medicaid. So when you look at our infant and maternal mortality rates, that is a result of the poor coverage, the poor access to care, and the cuts that we are seeing at the Statehouse. So imagine how much worse it will be if these cuts go through. So what are the other things that we heard about? Work requirements. Work requirements don't help anybody. I see patients every day working 2 and 3 jobs to make ends meet, whose jobs don't offer insurance or offer high-cost deductibles. I don't know many people that have $1,000 or $3,000 deductibles sitting around that can pay for their health care out of pocket. So that's one of the biggest issues. What about strains on hospitals and clinics? Most of our rural hospitals are supported by Medicaid. Those hospitals will be impacted and will be forced to close. What happens to our rural areas? They become deserts. They become deserts for care. The VA closing in Chillicothe would be devastating, but other hospitals have already closed, have stopped offering maternity care. Those things are real lives and real people. Increased financial burden. You heard about that in terms of nursing homes. Nursing homes are funded by Medicaid also, and that's another area where that financial burden will fall on families. So we really, really need to look at this, not just everything else people have talked about, but just the cost of losing health care for 1 out of 3 children, for over half of our pregnant women. All of that will be affected. So it's not about dollars and cents. What we need to ask is, do we believe in an America that supports all of us or that just supports billionaires? Do we believe that everyone deserves access to health care? Do we believe that we should have universal health care? Medicare is a form of universal health care coverage. When people are on Medicare, their outcomes are better, their access to physicians are better, and their ability to pay for their medications are better. But what is happening under this current administration is everything that Biden did is being rolled back. Insulin costs are going up. Medications that were designed to be low cost under the last administration are being taken away. So again, Medicare is a form of universal health care, and we need to work on that. We are one of the few developed countries that does not have universal health care. It's not hard, folks. It's taking money from insurance companies and giving it back to people. So what can you all do? You've been so patiently listening, and you've been hearing about the federal level. We've been trying to talk to our senators. I don't know about you all, but I kept getting voicemails every time I called. Yeah. So if you all talk to 5 people, as Sherrod Brown says, talk to 5 people about what you heard today. Call the Statehouse. Politics are local. Politics are things that are happening at the national level started at the state level. Here in Ohio, we have our own Doge caucus, for those of you who aren't aware. We are not members. And everybody here today is here because they want to make a difference. And I want to share the stage. So I'm going to turn this over to my state representative, Beryl Brown Piccoloantonio, to talk about the education piece.
Thanks, Dr. Somai. So my name's Beryl Brown Piccoloantonio. I am proudly the state representative for House District 4. I see a lot of you out there who live in Gahanna and Westerville, New Albany area. So thank you for being here. Thank you for the organizers for putting this together. What I'm going to try to do is, just from a big picture perspective, connect some of the things that we've talked about to what goes on at the state and local levels. So I'll talk about where we are in the budget process. I want to talk about some of what's happening with the Department of Education. And then I want to end by giving you some specific additional actions that you can take. It's really important by design, there is chaos that is making us feel paralyzed and unable to do anything. And it is really, really important in all of that chaos that we find the things that we're comfortable doing and pay attention and do those things. Because if there are all of us working together, on the things that we feel like we can do, they will not be able to paralyze us.
And they're counting on that.
They are counting on that. So how is everything that happens at the federal level connected to what happens at the state level? So we heard a little bit about the state budget process. We're still kind of in the beginning of the state budget process right now. So every 2 years, we pass several budgets, one of them being the main operating budget. And the way that we started going through the budget process this year was with an executive order that was issued on this president's first day in office that injected chaos into our state budget process. And why that is that approximately 30% of our state budget is dependent on federal dollars. So the executive order was issued January 20th. On January 27th, the Federal Office of Management and Budget issued a memo that you may have heard about that left all of our social service agencies uncertain of federal dollars that would be flowing to them, because the memo said that all of the federal agencies had to do a comprehensive assessment of federal dollars in order to ensure alignment with the priority and policy of the administration. This memo was illegal, just to be clear, among a number of illegal and improper executive branch overreach actions that this administration has taken. There were lawsuits that were filed ultimately the memo was rescinded, but it had an immediate and chaotic impact on how we were going to navigate through the state budget. We spent a week at the beginning of the budget process unsure about whether or not 30% of those dollars were going to be there. To put state spending in some context for you, the largest portion of the state operating budget is Medicaid. The second largest part of the state budget spending is primary and secondary education. And the fourth largest portion of the state budget is higher education. So I'm actually gonna cut short some of what I was going to say about the U.S. Department of Education, because honestly, it would take a lot more than 5 minutes to get through everything that I would like to say about U.S. Department of Education. But you may know that this week, the president signed an executive order with the stated goal of dismantling the United States Department of Education. From my perspective, it is unconscionable. If you don't know all of the things that the United States Department of Education does, I'll tell you just a few of those things. The U.S. Department of Education is responsible for enforcing compliance with laws related to discrimination in education. They administer the funds for all students who have disabilities. They administer supplemental funding to school districts with high percentage of low-income families and for students who are English language learners. And they also oversee the federal student loan portfolio. What does that actually mean? So Columbus City Schools, for example, has 46,000 students who attend. For Title I funds, so the kind of funds that are attached to students from low-income families and English language learners, that equates to, gosh, that number is so big, it's 51,474,000 in federal funds from Title I alone. 17 of Central Ohio's primary public school districts received nearly $53.5 million in IDEA funding in 2024. And 13 of our public universities received nearly $1 billion in federal funds from the Department of Education. So the dismantling of the United States Department of Education puts all of those things at risk. Yesterday, you may have also heard, and honestly, I'm not sure if this came in a tweet or by something that was actually said, but the president announced that the management of the student loan portfolio and programs for students with disabilities will be moved to other federal agencies. Yeah, I'm getting there. So just to be clear, the federal student loan portfolio is a $1.6 portfolio. There's 43 million borrowers. And what the president said is that that will move to the Small Business Administration. On the same day, the Small Business Administration announced that they will be cutting their staff by over 40%. And as far as some of our most vulnerable students go, our students who have disabilities, the president has said that, quote, Bobby Kennedy from Health and Human Services will be handling special needs. I don't know how you feel. I mean, I can hear how you feel about that. I don't feel very good about that. And that, like I said, that just scratches the surface of everything that has gone on related to education. I want to be respectful of your time and everybody else's time, so I do want to give you some specific action items that you can take. One of those action items, I don't know if you heard, but our governor actually was with the president for the signing of the executive order related to the U.S. Department of Education. So one of your action items is to please contact our governor and let him know what you think about that. I would also ask you, we've heard a lot from a lot of you, but please don't let up. Keep contacting your state elected representatives and state senators. We need you to demand that we continue to phase in the Fair School Funding Plan. We need you to demand that we prioritize funding for students with disabilities and students from low-income families. This is sad that I'm asking you to demand this of us, but we need you to demand that we feed children so that they can learn. And then I've got a couple other asks, but over the next couple weeks, please also call the state senators and your governor and ask your state senators to vote no on Senate Bill 1 and ask the governor to veto Senate Bill 1. You've already heard about everything that you need to be doing, that we ask you to do in reaching out to the federal government, but I'm going to leave you with one more ask. And the last ask that I have of you, so next year is a local election year. And I know that local elections don't get the kind of media coverage that our federal government gets. But my last ask of you is to please, please, please pay attention and help where you can with our local elections next year. We've got school board members up for election, city council members up for election, township trustees up for election. These seats, these positions are critically important in determining how what happens at the federal and the state level will impact your local community.
One last thing, and I think you've heard the common thread today. America is a land of opportunity for all of us. Let's not create a place where billionaires succeed and everybody else is left with scraps. Let's get out there and fight for democracy, fight for a society that's just.
Thank you to public servants who believe in public service.